Hello, everyone, and welcome to a Functional Aging Institute webinar. This is Dr. Cody Sipe, one of the co-founders of the Functional Aging Institute, and we're excited that you guys are here with us today. We have a great presentation for you that I'm really excited about myself to learn from. Jeff Alexander is with us and is going to be teaching us his personal method of SMR, which, I don't know what kind of person you have to be to name a method after yourself. I mean, that certainly says something about him, right? No, just kidding. I think I was thinking about maybe I need to develop a site method of something, but I haven't really figured out what that's going to be yet. So anyway, Jeff, we're very glad that you're here, so thank you for joining us today.
Thank you very much, Dr. Sipe.
Well, a little quick background on Jeff. Jeff has a very interesting background. One former Marine out there, so early 90s, I think you said, yep, in the Marines. So, and then a formal training in engineering, and so he's kind of taken that engineering mindset. If you guys know any engineers out there, you know what type of mindset, that precision mindset that engineers have, and really decided he wanted to shift to working on the human body. And so is really focused on working with clients of all ages and abilities, kind of spread the gamut in his background, really focusing on, how do we improve functional movement? How do we improve functional movement patterns? And so developing this self-care strategy is, I guess you could say, Jeff, is really a result of years and years and years of both training on your side, but really doing and applying it and trying out methods with your clients, wouldn't you say?
That's exactly right. It wasn't just one school of thought. It's been a blending of more than a dozen different influences over the years and different practitioners and professionals that I've met with, worked with, and learned from. And whatever was missing, we added some of that into the curriculum because there were certain parts that weren't being fulfilled by some other thinkers in the SMR or trigger point or adhesion theory mindset.
Yeah, it's really interesting. Jeff and I actually met last year at the Idea World Conference. We had booths that were near each other, and started to chat a little bit. And he shared with me some stuff that he was doing. And I'm kind of one of those guys where I've been in my own world, working with older adults so much that I really didn't know a lot about self-care strategies, to be honest, and any kind of rolling methods. And so he kind of got me on the floor there and helped me with a few things. And we chatted kind of some background stuff. And I thought, this is probably one of those I want to say missing pieces that we need to integrate into our overall approach. And so we're definitely glad that he's kind of here to share with us his strategy, especially it's working with clients of all ages, but obviously we want to focus on that kind of 40 and over client. So Jeff, really quickly, why don't you just kind of give us that in a nutshell? What are we talking about here? What is this thing?
Okay. Sure. My wife and I started working with clients in Southern California in the late 90s before we were married, and we found that a lot of our clients would come in and train with us, and then they would leave, and they would come back, and in many cases they were gone for a week or two. They went on a vacation or something, but when they came back to see us, they were more wrecked than they were when they saw us last, and it wasn't because of something we did to them. It was something that they did or didn't do when they were away from us. So we found that there was a missing component of what the client takes with them away from the gym. And with that in mind, we started giving them homework. We started telling them, this is your homework to do. I want you to, stretch your calves every night before you go to sleep, or I want you to take a hot bath to relax those tight muscles in your back and your hips and your neck. And over the years, we collected various different techniques and suggestions, and really learned some of the mistakes along the way since 1999 when we started having our private clients do this, that there are some very effective tools out there that clients can use on themselves, but they may not be all that safe. And so around about 2005, 2007, we started looking for a system, a packaged system that our clients might be able to use that was safe and effective, and maybe we could teach them or learn from some professional and so on. We found a couple good programs out there, but they were somewhat incomplete. They had a lot of good information for the lower body, but hardly anything for the neck and the shoulders, or vice versa. They were really good with dynamic mobility stuff or warm-up stuff, but they weren't so great with what does a client do after they've been sitting on the couch for hours or sitting at their desk for hours. So we found all these other systems were good in their own right, but they were maybe a little too isolated or a little too specialized. So we started looking at what can we do for the general population It's not just the athletes, it's not just the older, it's not just the younger, but what can a person who has limited anatomical knowledge, limited knowledge of biomechanics, what can they do away from the gym, away from the tutelage of a trainer or a professional with a PhD like yourself that knows much more than the client does? What can this person do that won't hurt them and help them maybe to move better, to open up some tight, muscle areas that affect joints and so on? And that's where the name Alexander Method of SMR kind of came from. Was we wanted to let people know that we weren't adding our own mix into someone else's program, because other people that we worked with, some of them got a little offended that we would show techniques using their products in ways that they had never shown. And it wasn't that it was dangerous, but we had people asking us questions about how do I address the rhomboids or the lats or the traps, and the system we were using or the products we were using, they didn't have any techniques for those areas. So the Alexander Method of SMR was born not out of a egotistical, narcissistic, I got to put my name on it kind of thing.
That's right.
It was really a matter of, how do we know that this is a system that's different from or separate from this other stuff that was out there in the market? And so we started teaching classes in 2008 using whatever tools were available, whether it was the grid or the other products from Trigger Point, or it was the black Nimbus foam roller or the white foam roller that's been around for forever. We used everything, lacrosse balls, you name it. And what we found was we need to have a system that uses a roller and a ball concept. So that way you have more of a general release and a specific release. And then we want to combine those techniques with movements, whether they're stretches or they're activation movements like exercises. But we want to link those two things together. So we show a client, here's a technique you can do to massage the quads like you see on the picture right now. And then after that, maybe we do some squats or some lunges to make sure that the muscles do actually move better and work better, so we can tie the idea between SMR or self-myofascial release and actual movement. We can tie that idea together for clients, and they can see that 1 + 1 = 2. This woman on the picture, real quick, I want to point out, she's about 50 years old in this picture, and she's a gym owner out of Colorado, and we met her a few years ago at a certification we taught in Northern California. And she might look like she's laughing or crying, but she's kind of rotating those thighs on the roller using that rumble roller for the first time. And if you've ever used a bumpy roller compared to a smooth one, you probably can appreciate that those muscles respond with a bit of a jolt at first.
Oh, I can attest to that for sure. Yeah. Well, I think what's really great about this method is, we look at kind of where training is going, and certainly we see there's a lot of intense workout programs that are out there right now, that are go hard, go to the max. And one of the keys for anybody, regardless of what your goals are, is recovery, right? You've got to have good recovery and self-care methods. The other aspect is our aging population, which we're obviously interested in because, as they come into exercise, they are very holistic. They want to think about the whole longevity of their body, not necessarily driving themselves for a short-term goal. And so to kind of put some self-care strategies in their hands that they can go home with, and like you said, aren't too over their head conceptually or biomechanically, where they can get it, they can use it, they can get results. I mean, that's just going to magnify the benefits that they get from their exercise with us.
That's what we think too, yeah.
All right, so go ahead, Jeff. Tell us a little bit more about this.
Sure, absolutely. We had discussed different ideas to present to your group. One of the things we talked about was about a half dozen or a dozen different ideas we could do, mainly because the Alexander Method of SMR is not a singular concept. It's not just only do this technique this way and that's that. The idea behind our program is that we have a human body with a certain number of muscles and a certain number of joints, and those muscles may or may not work well in certain clients. Out of all the different ways we could take that idea and run with it, whether we get into sport-specific, preparations or injury recovery, rehab. You and I talked about some, a limited list of things so we don't overwhelm the participants or the clients. And here we have a few presentation objectives for today. One of them being identifying the movement dysfunctions due to tight muscles. How would you, as a trainer or as a coach, recognize that there is a movement dysfunction that might be caused by muscles that are just too tight? Two, how to recognize which muscles are restricting proper motion within that joint or that matrix. So not only how do we recognize that there might be a tight muscle, but which muscle or muscles are actually the ones that we need to relax or release tension in. And then thirdly, determining proper pressure applied with any SMR tool. We see a lot of people that get a roller and they tell us I need something harder, I need something more aggressive because I just don't feel it getting in there. And in many cases, the pressure that they need to apply is not the problem, is how they're going about doing the technique. But in other cases, they do need a firmer tool, because if they have too soft of an object, you're never going to feel it getting into certain deeper aspects of the muscle. So we're going to cover these 3 points and get into a little bit of the detail on this. We have over 70 different SMR techniques that we teach over the course of 2 full days of instruction, and it's far more than 1 hour's worth of content. So we want to whittle down some of that content and just keep it simple and effective for your group today.
Awesome.
So first up, identifying movement dysfunctions due to tight muscles. Just because someone moves poorly doesn't mean that it's a tight muscle that's causing it. They could have some type of mechanical flaw in their body. I put up a picture here with 3 different versions of a squat just to give a very a familiar idea to your participants. We've got the neutral squat there in the middle. We've got the valgus and the varus on either side, showing where the knees are too much in or too much out and so on. We're far more commonly going to see knees dropping in than knees dropping out. Matter of fact, there are some presenters that have made a big to-do out of knees out, toes forward, and so on. My wife and I had a Irish athlete, former rugby player, come into our gym here in Southern California with knees that really bothered him because he was actually doing the knees out concept a little too aggressively. He had caused a little bit of instability in his knees by pulling his knees too firmly out outside the path of his pinky toes. So neither varus or valgus at an excessive level is good. We want to make sure we have a proper range of motion and safe movement. So number one, when identifying a dysfunction with tight muscles, you need to know what the proper movement is for that given client during a given exercise. If you've got a client that's 90 years old, like a Asian woman I trained here in Irvine, she may not be able to squat parallel or below parallel because of knee surgery, like she had a knee replacement and other issues. So first off, we gotta associate what's the range of motion for that client, what's the safe and effective range of motion they can normally do before we start saying, oh, that's because of a tight muscle. It could be because of some other injury or restriction that they have. One of my friends here in Southern California has an elbow deformity where he cannot straighten his elbow and never has been able to his whole life. And that's because of how the ulnar and the olecranon and so on, how all that bone tissue is shaped. He literally can't straighten that elbow. And that's not a tight muscle issue. So let's make sure we look at, is it a muscle problem or is it some other type of a problem? So is a client typically capable of that range of motion in all joints? That's our first step. Second step, here's a picture of my wife and here's a picture of me. Notice our hands. Notice she's sitting there and I'm sitting there. She's on the left, I'm on the right, and then her hands are well off the ground, a good 4 inches. My hands are firmly planted on the ground and I have a bend in the elbow. We're sitting on the same surface. I'm just a lot longer armed than she is. And the point here being is that just because you learn a technique of how to place the hands or place the feet or the angle of the spine whenever you're setting up for a deadlift or something else, if there's some reference to how the body's supposed to line up and it's not taking into account the bone length and the other deformities or abnormalities, surgeries and so on that may have happened to that client, especially as you get into older populations, you might force a client into a position that they physically are getting injured trying to attain.
Did you just say your wife has a bone deformity? Is that what you just said?
I actually lovingly call her T-Rex because after this picture, it's
she's
clear.
Gonna kill you.
She literally has arms that are fairly short for her body length. I mean, her greater trochanter, right there in the mid-thigh hip joint, that bony notch is actually below her hand, whereas in mine, that greater trochanter is well above my hand. So my wife has a really good sense of humor. She would have to put up with me for all these years. But we actually try and be very upfront and honest about what limitations we each might have, and let's work with the client in front of us rather than the ideal that may not even exist right in front of us.
Yeah, good point.
Yeah, so the step one, you got to know what the given range of motion is for a client, what they're capable of. Step two, you want to recognize if a scaled version of the movement is possible. So if they can do a partial squat with good safe range of motion, neutral positioning, and so on, maybe that's where we start because of the hip flexors, the hamstrings, whatever other complications there might be for that full range. So if we do a sit-down, stand-up to a chair, that's essentially a squat, but it might not be a very deep squat. And we don't need to force everyone into deeper and deeper. That's not always best, but let's recognize the movement as range of motion that's safe and effective for the client. There are, as I'm sure you know, Doc, there are injuries and neurological disorders that can limit how the muscles fire, what order they fire in, and so on. And those problems are really better treated by a healthcare professional rather than a trainer or a coach in a gym, because those are issues that need proper medical assessment. So if a client has a neuropathy or some other type of injury, I worked with a woman who was in her 30s that when she was 16 years old, she was doing horseback riding, got thrown, and the horse stepped on her forearm and actually damaged the nerves so that she had no feeling in her hand.
Mm.
The palm of her hand was completely numb. She could still use it, but she had no sense there. So in certain cases, we don't want a client to just go harder or just imagine whatever it is. Maybe they should work with a doctor or a physical therapist because it's outside the scope of a personal trainer's knowledge base or their credential. Second step here still, does a client's range of motion improve as they progress through the workout? So in other words, if the client warms up, does their range of motion get better? A lot of times the muscles will allow you better range of motion in a joint as you just limber up. So let's look at that aspect to see if it's a tight muscle issue more so than a joint, either a deformity, injury, or something else that might be keeping that joint from moving right. When you're identifying movement dysfunctions due to tight muscles, going through this little short checklist, is the client usually able to safely perform the movement? Yes. That would be something that might lend towards it being a tight muscle. Are there no medical issues present that we know of? Yes. Well, then that could lend the idea towards it being a tight muscle. And then also, does range of motion tend to improve as a client warms up? If all three of these are yes, then we're looking at a pretty good chance that it might be a tight muscle issue. So we might explore that. So getting into how to recognize which muscle it is, we would then look at, in this case of maybe a valgus knee position on the squat, are the adductors too tight? How do you know it's the adductors? Well, first off, you got to learn your anatomy. There's a lot of trainers that really are deficient in their anatomical knowledge, not because they've never learned it, but because they just don't use it. They're maybe 5, 10, 15 years or more into their training, and Cody, as you know, a lot of clients, they have no idea what muscle names are. They don't even want to know what they are. And so a lot of trainers get kind of lazy in their verbiage, and they don't speak about the muscles. And I'm not saying you should be an academic textbook when you talk to your clients, but maybe tell them, hey, you know what, you got these muscles called adductors that are inside your thigh there, and they pull that knee in. Why don't we see if those are a little bit tight? And so by addressing the right muscle, or at least by knowing the right muscle, you have a pecking order of where to start. I would like to mention on our website we have anatomy images like this one that I have here, where it just clearly shows the adductor magnus and then some of the other muscles that are laid over that area, underneath or over that area. That anatomy image, I actually drew that in Photoshop. So that I bought the bone image with the skeleton, and I drew every single muscle that's relevant to our techniques, so that it's just the muscles and the bones and joints. So you can very easily see, this is a clear image here without the complexity like a Gray's Anatomy manual where you have the veins, the arteries, the fascia, and so on. So if you want some easy to identify muscles on joints, anatomy pictures, just go to SMR Tips and click the anatomy link. We have 3 images available. Next up, we got step 2. We want to begin massaging and stretching the largest muscles that attach to the area with poor ROM. So if you have a client that have that valgus knee issue, where the knees drop in on the squats or when they land on a jump, maybe massage those inner thighs a little bit. Spend 2 to 5 minutes working through that tissue slowly, not real quick, not very aggressive, but think about what you're doing on a massage table. If you're on a massage table and you have a therapist working on you, what are you physically doing at the time? You're doing nothing. So try to mimic that part whenever you're doing this self-massage stuff. The rumble roller is ideal for that type of technique specifically because the bumps will do the work for you, allowing you to focus more on relaxing. Now, there are vibrating rollers out there. There's all kinds of other tools that you could use. I'm not saying you have to use only one, but take a look at which tools you can relax the most on to massage those muscles. That'll get you a better effect. We have 70 different techniques to choose from in our methodology, but each technique has its own scaled version. So there's almost an infinite array of how we could work on those techniques. Cody, you and I talked about some of these techniques on the floor that are going to be really impossible for certain older clients that have limited range of motion and ability to get down and get up. We also talked about me putting together a program for you that's going to show some scalable options with these different tools. So maybe you can do this in a seated position or some other position that would be a little easier for the client to get into and out of. Those will be coming soon. You and I are trying to put those together maybe for the spring or summer of next year.
That's right.
So just because there's a technique here showing me laying on the roller with my inner thigh, that's not the only way we would ever address the adductors. By improving the function of the prime movers in many cases, your client's smaller muscles, let's say the IT band issues they might have on the outside of the hip, the piriformis issues, the SI joint issues, many of those other issues that are very plaguing to a client can be minimized or even removed if they just start addressing the bigger, more impactful muscles on a regular basis that might affect that joint, such as the adductor magnus, the hip flexors, certain other areas that would have a really strong pull on that area. We get those to relax. It's amazing how quickly the other parts come along.
Now, Jeff, how do you know, like if you're using this example here, how do you differentiate between, okay, we've got a tight adductor muscle versus our abductors are weak? How are you differentiating that?
Well, in a sense, we're going to take a look at the bigger of the two. So which muscles are physically bigger, the adductor magnus and the other two adductors plus the pectineus on the inside of the thigh, or the lateral rotators and the abductors on the outside of the hip? Which one's physically bigger? And the gluteus maximus is rather large, but it doesn't work as strongly as an abductor as it does as an extensor.
Right.
So in that case, we're going to look at do the muscles move better, do the joints move better, and then get into the other muscles on the backside of the hip as well. We're not going to identify just one and stick there. We're going to work back and forth between the front side and the back side to get our best results.
Mm-hmm.
And they're going to use movements in between to identify that. So what I want to impress upon your participants here is not that it's only the adductors we look at when it comes to a valgus knee condition, but from a trainer to a client, and from a client not having any anatomical training or biomechanics training, let's not confuse them with it has to be this first, this second, this third. Let's say, hey, you know what? Look at the biggest muscles in your thighs that pull the thigh in. That would be the adductors. Let's take a look at those and see if we can loosen it up. And then let's do some like sumo squats, or maybe do some frog stretches or other stretches where you open up the thigh, Indian style sitting, whatever it is that's reasonable for a client. Have them do something that they can identify where they say, now my hip opens up a little bit easier than it did before, or it doesn't. But at least we can connect them to a movement and an SMR technique rather than it being, okay, which one is it first? Is it that muscle that's on the inside thigh or that muscle that's on the outside of the hip? Let's just get them doing something that's safe and effective without hurting them. And then from there, we move on to a better identification by testing and retesting. So this step 3 is a critical part of knowing which muscle is going to be the more important one for a client, which one's not. It might not be the adductors. It might be that they have another dysfunction through the spine, the hip, the nerves that come through the backside of the hip, the sciatic nerve, and so on. But let's take a reasonable, sensible step, one step at a time. So we start with the adductors. We test out an opening of the hips movement of some sort. We do a test, retest, see if that feels better. If it does, we keep working through that area. As the adductors get less tight, they should be pulling the thigh in less, which means that piriformis and the other 5 lateral rotators out there, that quadratus, the quadratus femoris and so on, all those deeper gemelli and obturators, we get those muscles unloaded a bit by unloading the adductors if the adductors are very tight.
Mm-hmm.
So the outside of the hip and the SI joint issues and so on, they can be minimized to some degree on a self-care basis if you just take some of the stress that pulls the thigh in and up. Right? Taking that stress away will help the other muscles that pull the thigh out and back. It'll make it easier for those muscles to work, and there'll be less stress on the backside of the hip as well. But we're not saying you can cure SI joint issues just by doing this. We're saying let's look at the muscles that impact the hip and the joints that are affected, and let's see if we can release some of that tension in those muscles. So step 4 here, we address the second largest or second most influential muscle that affects a certain joint after going with the first one. We want to work around that joint. We don't just tackle one area and that's it. As you know, Cody, it's never one muscle that's the problem and that's it. There's going to be a combination of factors. There's maybe an injury to the shoulder or the hip that caused problems up the chain and down the chain. So for our clients, let's not teach them just this one and that's it. Let's teach them a kind of a pattern, a way of addressing that area. So the front side of the hip, the front and inside of the thigh, the outside of the hip, above and below the hip bone. So we're in the lower back, we're in the thigh, we're in the hip. We have over 90 different stretches and functional movements that we pair with the SMR techniques. And there's no way we can put every stretch or functional movement in any library because there's so many variations of how we move. We're trying to get people to think about the process rather than the individual memorization of this one technique. Because every client's going to have a unique set of dysfunctions, but there are going to be some common dysfunctions we'll see amongst a lot of clients. We need to look at the client that's actually in front of us instead of just trying to say, okay, if you've got SI joint issues, this is how we fix that problem, and that's it. Because there will be somebody that gets in front of every trainer that the situation with that client is not going to fit any model that the trainer has learned. And so we need to be not so proud as to say, I have all those answers in my head. There's a time and a place to ask for Dr. Cody's site, help me out here, I don't know what I'm talking about, or ask the physical therapist that's local, or refer out to the orthopedist. So as a trainer helping a client with their issues, we should not take the responsibility to fix everything.
Yeah, I think that's so, it's especially true with older clients as well, because you've got so many different issues related to not just the aging process, but years of inactivity, past injury, chronic disease, surgeries, joint replacements. I mean, it's kind of an endless combination of things that come in. So you really have to treat every individual just like that, an individual. And I really like what you're saying is refer out or reach out and get some information from somebody else who can help, or, with that issue, because it can be pretty complex sometimes.
Yes, sir. And that's one of the difficulties with having a group exercise or a group recovery class for older populations is you have such a wide range of problems inherent in the participants in the class. So we do have ways that we can structure a group SMR class that allows for some latitude so that not every client has to go through the exact same technique the exact same way, but we are teaching a class that flows so that we cover certain areas of the hip. Let's say we cover the adductors and the piriformis and the medial glute and so on. We're going to cover those areas, but we're going to teach the clients in a way where they can identify and recognize what are their trouble areas compared to their neighbor, the person sitting next to them. And by them identifying better what their trouble areas are, they can be more empowered, even in a group setting, where they can take some homework with them that's applicable to them. So how do we recognize which muscles are restricting proper motion? In essence, we're going to learn the muscles that attach to a joint with the range of motion issues. So if any of the trainers out there don't know, there's 4 different muscles in the quadriceps, or the lateral rotators, the abductors of the hip. It's a good idea to crack open a book and go look at some of our information and find out what those muscles are called. It'll help the trainer to better identify movement problems with their client, and it'll also help the client to better understand what's going on if the trainer can explain it with a little bit more knowledge at their disposal. We're going to begin with the largest or most influential muscles or muscle groups. In the Alexander method, we start with the core. We have the rectus femoris in the quadriceps, which is as our first primary, specifically because that muscle works as both the hip flexor and a knee extensor. It affects the 2 largest joints in the body. And if we get that rectus femoris muscle working better, it does help so many other areas of movement just by helping the knees and the hips to work a little bit better. So we don't stop with the quads, but we start with the center quad because it works as both the hip flexor and a knee extensor. We work through the psoas and other muscles as well, but we want to start with the least level complication with our clients. So we begin with the largest and most influential, but then we work towards the next largest or next influential basically as we need to. So if that first rollout that we did for the adductors, if that takes care of the problem on the outside of the hip, we don't really worry about that too much. We don't spend a lot of time trying to massage out a problem that doesn't exist. We just take it one step at a time. Let's identify the movements afterwards. Let's make sure that we're making proper progress. And if we are moving in a forward direction with it and the client is moving better for it, hooray, we're on the right path. So in a sense, we try and keep it simple. So we keep it a conservative, simplified approach so the client is not overwhelmed. We don't want to try to impress them with how much we know and at the same time lose their ability to understand what they need to do.
We have one of our attendees asking about arthritis. If you're talking about those muscles attaching to and affecting those joints, what about for people that do have a significant amount of arthritis in that joint? Are these techniques going to be, safe and effective for them as well?
Yeah, I would encourage them to explore the concept, but I tell trainers that take our classes, consider that every one of these techniques are dangerous. There is a possibility that what we're doing through this massage stuff is going to complicate the problem that a client might have. So don't assume it's safe. It's better to assume it's not safe and approach it with some caution. But with that said, I have a client currently who's 86 years old, male, had him for about 9 years, and he is more functionally capable and less bothered by his arthritis of the big toe in his left foot than he was 9 years ago. And it hasn't taken a tremendous amount of massage of me teaching him stuff to do on his own. It's mainly getting him active, recognizing movement dysfunctions when they come up, improving his movement patterns, whether it's through the SMR techniques or it's through him learning the movement better, so he actually isn't reinforcing bad mechanics with wrong coordination.
Mm-hmm.
So it's been a combination of influences, but it has improved, and it should improve with any client. But keep in mind that I can't guarantee that an arthritic condition will respond properly to this. As you know, Doc, there's so many complications with circulation and other genetic issues that it may be that client exacerbates an arthritic problem by pressing on a muscle that's already pulling tightly on a joint, and the stretch reflex kicks in, and that muscle pulls even tighter and makes our arthritis feel worse. So I would encourage the trainer with an arthritic client to approach this very cautiously, because we'll get into in just a second how much pressure is appropriate. And it is possible to stimulate the stretch reflex and have a muscle tighten down more after doing a massage technique rather than releasing tension in the muscle. So do proceed with caution, but it should help the arthritis over time. So next up, determining proper pressure applied with any SMR tool. You'll see a range of tools up here. I intentionally went and found marshmallows, which nobody would use, but there are some tools that are extremely soft, very, very soft, rubber balls and other things that somebody might use, or the white foam roller and so on. Even those soft tools for some people can feel rather painful, especially at first. So find the right tool that's good for the person. On the right side, we have those metal gears. That's probably outside the range of safety for anyone. But we actually do have people that come into the rumble roller booth at various expos and say, hey, do you have these in wood or metal? Because they think the rumble roller, they think it's great, but they're like, it needs to be harder. And the answer is no, it doesn't need to be that hard. If someone feels like they need a wooden or a metal implement to get in there, either they have a condition that they need a therapist to do it for them, because that's not something you should be doing to yourself, or it's that they don't know how to relax, and that's the more likely probability. Most people, when they go to massage themselves, they plank on their elbows or on their hands, and they roll their thighs back and forth, or they sit on their backside with their calves on the roller, and they lift their hips up off the ground, they roll quickly back and forth. They think about doing the rolling out as a exercise or as a movement, when really what we need to do is have them relax and let their body wrap around that object. Let the muscle tissue allow that object to sink into it. You'll know how firm is too firm rather easily, because if you lay on top of the roller or the ball and you completely relax your body and it's too painful, guess what? That's too firm. So we need to modify that technique, we need to modify that position, we need to modify the tool based upon what the person can tolerate. 5 years ago, my wife and I chose the rumble rollers as our exclusive roller of choice in our certifications and workshops we were teaching, specifically because the material is a polyphenol blend of elastomers, which is a fancy way of saying it's an elastic material that's going to squish under weight, that's going to go right back to its shape again and again and again, thousands and thousands of times, but it's not as firm as that metal or wooden object. And it makes it so that the material is actually softer than tendon or bone, so it's very safe for a client to experiment with what position, with what area of the body, and so on. But the foam material, or I should say not foam, because it's not actually a traditional foam, but the material the rumble rollers are made out of is actually firmer than a relaxed muscle. So if you do relax and then try to do a massage type technique on these rollers, you can feel those bumps digging in and grabbing, kind of like a thumb working through those tissues. So it makes this particular product a very safe and effective tool for a client to use. Whereas, like we were just saying, maybe that metal roller is too firm. There are certain, other obvious ones like scalpels. You wouldn't have a non-medical person use a scalpel to just work on taking out their appendix or something like that. That would be insane. But we have clients that think in terms of taking a very firm plastic or very firm metal hook, put it over the shoulder, and they start rubbing and going to town on their back or their shoulder or their neck, trying to work out neck tension. And I even had one client in his mid-60s who took one of my hooks with him over the weekend at my request to work on his shoulder. He comes back on Monday, and he cannot lay his shoulder against the bench or against the wall because he had worn through the outer layers of epidermis by rubbing and rubbing and rubbing all weekend long with this firm tool. So he literally caused a surface skin injury by using that tool too aggressively. So we have, over the years, found that there are certain tools that are may be good for a client, but you have to use your best judgment with whether a client has that wherewithal to understand they're injuring themselves. So choose the tool based upon the client knowledge and ability to recognize they're going to damage themselves. Number 2, how much pressure is too much? Part 1, we have several parts to this. The bumpy rollers made by Rumble Roller are really effective at getting into the muscles when you relax, and that's why we particularly like them. Now, Rumble Roller contacted my wife and I about 4 years ago because they saw some of our online videos and they liked the way we teach. So we are actually a separate company from them, but we do endorse their products and they endorse our education. But we found people in any position, or rather with any tool, if they learn how to relax first, they'll get a whole lot better effect out of that tool. And so you'll see I'm lying there on my back with my hand on my forehead, or my forearm on my forehead. You do not have to apply more pressure just to get into certain muscles. But you need to relax first, otherwise the pressure you do apply will be less effective. So we'll see people taking a kettlebell or something else and holding on to that while they're working on their back or something, and it's maybe more effective because of how they're going about approaching the technique. But if they first learned how to relax and then did as little movement as possible to massage those tissues, they would get a much more beneficial massage effect than really getting more aggressive and activating the muscles even more while they do it. So that's why we tell people to use leverage, gravity, and torque instead of force to try to get into those muscles, because then they can focus more on relaxing and allow the body to move into position.
Yeah, I'll tell you, I use the blue Rumble Roller because the black one is just, I tried that one, and it was just too uncomfortable for me.
And that's a thing.
Yeah, and with the blue one even, using some of the techniques you were talking that you kind of taught me with relaxing, through your breathing and gradually relaxing into it. I mean, it will dig in more and more as you basically relax and allow your body to sink into it.
Yeah.
So
and that's the thing, is that Rumble Roller was invented by a mechanical engineer with many injuries from the 80s through to the last actually even currently. His wife just recently had surgery on her shoulder because of a delamination of the shoulder blade, which is not the fascia around the shoulder blade. So he has a long history of certain issues himself, and he took his engineering mindset and put it to making products that didn't exist on the market, and they really did pioneer the aggressive bumpy foam type of a product. There were bumpy wooden tools and other products, but the inventor of the Rumble Roller took his knowledge base and his chemical engineering friends and so on, and kind of tinkered on his own to come up with a product that he felt would satisfy his own needs and needs of persons like him. And it turns out that he and I are very much like two peas in a pod, but I have a focus on how the client uses the tool, and he has a focus on trying to provide a safe and effective tool for the client. So we are kind of a symbiotic match made in heaven or hell, depending on your perspective. But the tool, he says that he invented this tool to be more aggressive so that you don't have to be. And so that way you have a product that allows you to focus more on relaxing and then let the product do the work for you, but you don't have to plug it in. You don't have to have anyone doing it on you. You can actually let the tool do the work, and then you do very, very little motion to accomplish that release we're looking for.
Mm-hmm.
So step 3 here on how much pressure is too much. We've got a couple different concepts I want to talk about with the anatomy as to how we identify too much pressure or not enough pressure. We got the muscle spindles that activate when we stretch them too far too fast. Then we got the Golgi tendon organ and the tendons that sends a signal to release or stop the muscle from firing when there's too much tension placed on the tendon for too long. Now those two concepts, we really need to let those concepts sink into our brains, and we really need to have that like gel and become part of our normal workings of how we approach all movement. Because if we understand the connection between these two concepts at a very intimate level, it gets to be very easy to explain to a client how much pressure is too much when they're doing a technique. Because you can't feel what they're feeling, but they need to feel the muscle relax. There is an absolute connection between that release in the muscle tension and them feeling a relaxation that happens. And if they can't feel a relaxation, then they need to take just a few more seconds or a little bit more time to focus on more of a meditative process rather than an actuation or an activation or some type of a exercise type process. It doesn't really matter what movement you do in some cases with a ball or the roller or whatever tool you're using. what matters the most is that you relax and you feel the tissue actually unwind or let go. So we need to first get the client to understand how they can relax. And if they've learned how to ride a bike, if they've learned how to operate a computer, if they've learned how to drive, they've got the knowledge and patience to be able to learn a complex process. This process with the Golgi tendon organ and the muscle spindles can get very, very complicated when we start talking about all the different nerve and muscle parts and everything else. The important part that I'm trying to get across to your listeners is that the muscle spindles activate when we put too much pressure on a muscle too quickly. Adding tension to a muscle with a tool such as an SMR tool, adding tension to that muscle very quickly or moving very quickly is an activation technique. When you sit and relax and allow that tool to dig in and it holds tension on that muscle for a little while, maybe 20, 30 seconds, maybe longer, that Golgi tendon organ is typically going to start to fire up a bit. It's going to interfere with some of the activation of the muscles, and the muscles should relax. If the client's muscle is not relaxing while they're laying on that roller, Cody, that's like what you just said about the black roller. You lay on top of it and you relax, and it actually hurts, or you don't feel yourself ever relaxing. That's what tells us that the tool is too aggressive. It's not your weight necessarily. It's that the tool itself is too hard. Then we find like the blue roller. We tried that one out. That one felt a whole lot better, and you could feel yourself relax. We've just identified how you can tune in, as well as which firmness of product is the best one for you. So it's not that hard to explain it and to teach it to a client if we just understand this connection between activation of a muscle and release of tension in a muscle, and how those two are intimately linked. And it really depends on how quickly you load up the muscle or how quickly you move as to which of those areas we're activating.
So Jeff, let me ask you a quick question, because I'm seeing this a little bit more and more, and this is kind of very, I guess, historical in fitness, where, when things catch on, people start to use them. They start to use tools or techniques kind of blindly and ubiquitously. And kind of what about the whole, hey, just grab that foam roller over there at the end of this class, and, we're going to go through kind of this routine. It seems to be like there could be more harm than good that could come of that.
To some degree, yeah, and especially as we're talking about older populations, and I'm going to have a couple of slides there to address that. The idea here is that if the client themselves are just going through the motions, if they're just doing what their trainer tells them to, or their therapist tells them to, a quick segue here. My mom had foot surgery about 5 years ago, and she had her left big toe was underneath her second and third toes on her left foot. She had really bad abduction of that hallux, joint, and so her big toe was deformed, literally, and the surgery was the only way to really fix it. Well, she had a boot on that was put on after the surgery that she was supposed to remove, clean her foot off, and then put the boot back on. And she, for a couple of weeks, is doing this, at home, and then she goes back to see the doctor, and the doctor reacted rather alarmed to my mom whenever my mom walked into the doctor's office, and her foot was like a purplish black. And he immediately took the boot off and left it off for the entire visit she was there, and her foot returned back to a normal color. And it turned out that my mom was putting the boot on far too tight for her circulation to allow that foot to heal properly, and she thought that was normal. She was on painkillers from the surgery, so she couldn't feel how tight she was putting it on. The foot was already kind of bruised from the surgery, and so she didn't realize that she had the device on her foot that she was putting on herself. She was doing it far too aggressively. She did not realize that. She thought that was part of the normal healing process. And so my point is, if you have a client that is so disconnected from their own body, they can't even feel the muscles relaxing, there's a really good chance they're not going to understand if they're doing themselves a good thing or a bad thing. So let's not force them to do it this way versus that way. Let's talk to them about how they can understand what's going on inside their body, and work slowly with them, especially at first. Work slowly with them so they can start to tune in after so many years of tuning out. And then that process, that dynamic, when they start getting that idea to kind of take hold inside their head, everything else that we teach them, the other 70 different techniques, if we ever get to all of them, the other stretches we teach them, all that stuff works so much better if they understand that initial process of how we can get that muscle to relax. Does that make sense?
Oh, yeah, absolutely.
Cool. Okay, so here we got a couple examples of bruising.
Wow.
This is actually from paintball. It's not from lumber wood. So if you get bruising like this for a rumble roller, you are way too aggressive. Many clients are fiercely compliant. Like I mentioned about my mom with her foot surgery, they're going to do what they're told to do, or they're going to do what they think they're supposed to do, and they might not be doing it right. So let's be aware that a client may be doing something that's harming them more than helping them. We had a client here, 18-year-old college student, got a full scholarship for tennis. Very physically capable, very active young lady. She actually was bruising, not quite as bad as this, but rather significantly bruising every time she used a rumble roller or the Beastie Bar or any of the massage products that we had in our gym. We had her go to the doctor to get things checked out. It turns out she was anemic and didn't know it. So
Wow.
she had a medical condition that she was unaware she even had. So keep in mind, a lot of clients will develop or develop a condition or develop a complication that they might not have had before. And so let's watch out for that. If you're seeing bruising like this or anywhere close to this, that's not normal. Maybe a little bit, very mild discoloration the first or second time someone uses a massage product, that might be expected. But you should not be bursting blood vessels underneath your skin every time you massage yourself. That's insanity. The no pain, no gain process here, absolutely no way. That's insane. We should not have a client going through torture just to try and massage out knots in their thighs or anywhere else.
Mm-hmm.
Again, we're going to come back to this movement idea after we're doing a massage technique, because if we're just doing this stuff with the pressure and then we don't identify the movement has actually improved, you're missing a very big part of the equation. We want to make sure we tie the massage or stretch technique back into movement. There should be an actual test of the range of motion, a test of the comfort with range of motion to make sure that things are actually opening up and moving better. Cody, you and I went through some of this in the booth there at the IDEA convention. We always take people through a movement of some sort at whatever level they can do. There's a lot of clients that won't be able to do a squat like I'm doing there, where I have my elbows inside my knees, pushing them out wide. That's okay. This is not the only stretch they can do. This is not the only movement they can do. But take the movement that a client can do, and let's have them do that same movement afterwards and ask them the question. Let them answer the question for you. Do you move better? Does it feel easier to get into position? Do the muscles fight you less as you're trying to do this? If there's a decreased amount of discomfort, there's an increased or improved quality of range of motion, we're on the right path. So we're just trying to figure out how do we get on that path rather than how do we identify every dysfunction that can exist. Mm-hmm. Let's start by identifying one, and let's address that one, and then let's go to the next one as we have the mental and physical ability to do that. Let's not try and tackle everything all at once.
You're sounding a lot like an engineer. Very methodical approach. I love that.
So in determining proper pressure applied with any tool, first question we're asking, is the tool safe for the client to use? Yes or no? Does the position that they're getting into make it easy for a client to relax? Or is their body all contorted, or are they actually, like on a massage table, relaxed while they do it? Have we removed the external loads that may complicate the process of relaxation? Yes or no? In other words, if they're in a position where they have to activate their body to hold that position, it's probably not the best massage position for them to be in. Have we checked for a significant amount of pain or bruising? Even though the client might be doing their homework properly, they might be, like you said, Doc, they might be causing more harm than good. So let's make sure that we're checking in with them, not just making them check in with us. Let's make sure that we're giving them proper advice. And then if the client moves better following the use of any tool, then we should assume we're on the right path. If they are actually moving better, they have less discomfort, we are definitely doing the right things if that's the case. If they're moving worse, think about that stretch reflex. If they're tightening up in a certain area around a joint, it's likely that joint won't move as well after the SMR technique or after the stretch. There have been studies that have shown that static stretching has a negative impact on performance. I would suggest to you that those studies show that improper stretching is what has a negative impact on performance. So let's make sure the client is doing the stretch correctly, because in many cases a client is still too aggressive with a static stretch or some other stretch, and they are in that sense their own worst enemy. They're doing the technique wrong. Think in terms of upstream and downstream. I've got little circles around the elbow, the shoulder, the wrist, the hip, the knee, the ankle. Think about the muscles that are above and below. Think about the muscles in the front and the back. Don't get overwhelmed with all the minutiae. Just think about big general sweeps at first. Spend a couple minutes, spend 5 minutes working on one particular area. I've got 3 different pictures there of me in different stretches or SMR techniques. That one at the bottom is something we call the psoas press. I put a little overlay of the beastie ball underneath my core right there because that's what was underneath my abdomen, pressing into my spine, pressing into the psoas muscle. That's a technique that would be really good for addressing the psoas for some clients, but for a lot of injured or dysfunctional or movement limited type of clients, this psoas press is one that is not going to fit into their schedule. It's much better that they would have a massage done to them if necessary, and then maybe they do some of these stretches either using a pillow, a yoga mat, or something else. So there's not just one way to do the stretch, but your trainers and their clients will definitely respond better to these SMR techniques or the stretching techniques if they take a good 2 to 5 minutes to really identify tension and find that release point, try and figure out how that works for that one area, rather than doing a whole bunch of things really fast. Let's pick 1 or 2 movements and do them really well. So we suggest doing a primary technique, which we have 3 primary techniques in our system. We have 3, 1, 2, 3 for the quads, the adductors, and the lats. Take 1 primary technique and do that each day. Rotate through the list. Take 2 secondary SMR techniques, if possible, and do those each day. So maybe the calves and the feet, we do those together. Maybe the neck, for the back of the neck and the side of the neck, we do that together. So take a couple secondary techniques and do those each day. That's 3 total techniques, maybe 10 minutes, maybe 30 minutes on the long end. That's all we're talking about. Is like take 10 to 30 minutes a day to work on a certain area, and then tomorrow work on a different area. And the next day, work on a different area. And come back through the list like you would with exercises. You don't have your clients do squats every single day, but you do have them do something like a squat on a regular basis to work on the quads, the hip flexors, the calves. So we're going to make sure that we have a routine here for recovery that is a routine that goes through a system, but it doesn't have you doing the same technique every single day, and that's all you do.
Mm-hmm.
The objectives we have are identifying movement dysfunctions due to tight muscles, how to recognize which muscles are restricting proper motion, determining proper pressure applied with any SMR tool. That's an overview of how we might approach this with our system. We've got the website alexandermethodofsmr.com. That links to a bunch of other sites that go into detail about the certifications, about the SMR techniques, about some of the tools you might use, and so on. Cody, you and I had talked about putting together an online course coming up hopefully spring of next year.
Yes.
So we've got several different directions that I want to go with your client base with regards to the different levels of functional capability and how we're going to modify those techniques according to that group. So I would expect that we're going to have many more than just one course from my end for your team, because there's a lot of different ways we need to approach this and certain injuries, difficulties, and so on. So I'm very excited about this opportunity and the chance to work with some of your trainers and their groups.
Yeah, absolutely. We're excited about it too because, for those of you that have taken the functional aging specialist and you've heard me talk about it, I tell people this is kind of the macro approach to training. It's the big picture approach, right, where we look at kind of the physiology that's going on in the aging process and kind of apply functional training methodologies to that. And, like I say, functional training, in my opinion, is not a method, it's an outcome. If you're getting functional improvements, then what you're doing is functional training. So, that's the big picture approach, and what we want to do then is start to get into some very specific areas. And so SMR is a very specific area that we know is helpful and want to get more education out there. So we're really looking forward to that course. I want to encourage everybody to put on their calendars for next June 10th and 11th. We're going to have our Functional Aging Summit again. This year's was pretty incredible, and we're going to be bigger and better next year, and so looking to have some great information. So put June 10th or 11th, Phoenix, Arizona on your calendar, and also look for this new course that we're going to be developing with Jeff, and we will have announcements that's coming out about that. So we have just a couple minutes for a few questions, and one thing that I want to ask about is kind of related to kind of the system that you've developed, the overall system. So you've kind of given us some insights into that. When you look at your certification, how long is that? Like how many hours of training are we talking about in that certification program?
Got it. So we have a concept that we intentionally made somewhat accessible to clients as well as trainers. So we have 4 different days of instruction. Each one is an 8-hour day of instruction. And we were pre-approved through National Academy of Sports Medicine for CEUs. But the first day would be the level 1, and that's where we go through the 23 fundamental SMR techniques, some of which we talked about in this presentation. We talk about the approach of how to start with those primaries and start with some basic stretches that are going to open up the hips and allow someone to recognize they're on the right track. And then when to start implementing those secondaries and possibly looking deeper to the extended techniques. The level 2 certification is really targeted towards trainers and those people that would teach others the techniques they learn in the level 1. So we spend the day in the level 2 briefly covering the actual detail of the techniques of the level 1 course, but we get into how to put those SMR techniques together with various stretches and assessment movements and techniques and so on. So each participant in the level 2 is presenting to the group one or more techniques in a kind of a module of, we do a before and after assessment movement of some sort. Maybe we do a squat before and then we do the quads roll and then we do a squat afterwards. So it becomes much easier for a trainer to understand how are they going to integrate these SMR techniques into their clients' daily lives or their training. So the level 2 is really geared towards trainers that are going to use those SMR techniques with a variety of different people, and so they get that hands-on training time of witnessing as well as presenting a variety of ways to integrate SMR into that exercise routine. We just had a level 1-2 combination certification a couple weeks ago here in Southern California, and we had several trainers that work with older populations. We had a chiropractor there that works with all kinds of patients, but he's a very aggressively fit fellow himself. Then we had some CrossFit instructors. We had a yoga instructor. We had several different people from backgrounds that were so varied and diverse, martial arts and so on, that when we watched their presentation of how to integrate SMR with what they would have their clients do, it was quite a good learning experience, not only for the participants, but also for myself and my wife, because we could see these different ways people will use the information. So level 1 is 23 fundamentals. Level 2 is practicing that. Level 3 is 47 extended techniques. So there's more detail about the peroneals and the calves, or the anterior tibialis, or the iliacus within the hip. So there's more detail with the 47 extended techniques in the level 3 class. And again, that's a one-day course. And the level 4 is practicing integrating all the SMR techniques with various movement protocols, along with some programming of movement dysfunctions like the overhead squat, the lunge, and so on, and how would you identify maybe some movement dysfunctions that are due to tight muscles. So 4 different levels of instruction, two different levels of master trainers. The first level master trainer teaches the level 1 and 2. The second level master trainer teaches all 4. And so we have basically 6 different days worth of instruction. And even with that, we still don't cover everything. As I know you know, Cody, there's so much material here. We could spend weeks on it and still not cover everything.
Oh yeah, absolutely. So do you have like a listing of your upcoming workshops that people can go to and check out, like maybe when you're going to be on East Coast, West Coast, other areas?
We are putting together our 2016 calendar, and my wife and I are working with various different gyms to host us. So we will have some more dates going up very shortly, but right now you can see a few of them listed. There's a link on the Alexander Method of SMR site that has, this says education certifications. That link will take you to our SMR Certs website, which goes over where our calendar is and details on each class and so on.
Okay. And what about for people that, they're intrigued, they're interested, maybe they're not going to kind of do the whole certification course, but they want to get a little bit more insight and maybe start doing some of these techniques on themselves, right? Like, when I came to your booth, I was a newbie, right? I mean, I really was. So I needed to do just some stuff for myself and experience it. And like, I got your SMR tips DVD, and it was great. What do you think is kind of the first step for people like that?
The first step is going to be different for each person, but I think the DVD is great for a lot of people because they can rewatch several aspects of which technique they might do with which tool. The SMR Tips DVD is really meant as an overview of various techniques that we offer in our certification. I do go rather quickly over some of it, so there's not a lot of detail on certain techniques. If you go to the website, smrtips.com, which is actually linked through the Alexander Method site, so there's more than one way to get there. But the smrtips.com website is our online reference for education. For persons who have taken our certifications, they can access more material than persons who haven't. So there is some material that's limited to those that have taken the certs versus those who haven't. But the videos on the SMR Tips website are much more detailed. They're about 6 to 10 minutes long each one, whereas the SMR Tips DVD is it's a good 3 hours worth of content, but it's about 10 minutes on a particular area of the body rather than a particular muscle or a particular technique. So there's more detail on the smrtips.com site, but there's also a link to find a Rumble Roller certified trainer, which Rumble Roller and I are kind of co-branding the certifications together. Rumble Roller certified trainers are certified in the Alexander method of SMR. There's a link where you can find all those trainers on the smrtips.com website. You just click the link on finding a Rumble Roller certified trainer, and you can look in your area what trainers are local. They can come and teach you some hands-on stuff. They can actually help you with how to do those techniques in person. So as we have more certifications, we'll have more of a growing list of where to find those different professionals.
Okay. And last question is, how can people contact you?
Best way would be through that website, Alexander Method of SMR. That's going to link to everything we have. And my email, I'll go ahead and give it out here, jeff@smrtips.com.
Okay, that'd be great. So if you have, I know some of you have some very specific questions, that you're wanting to ask Jeff. So feel free to connect with him about that. You can access the recording, so we'll have the recording up and available within a few days, and so all of you will get access to the recording, so you can go back and really try to digest this information even further. So, Jeff, I just want to thank you again for taking the time out to share your expertise with us, and certainly looking forward to working with you more in the future, and especially as we kind of develop that course together. So thank you.
My pleasure, and thank you so much for having me.
All right, you guys take care.